Alright, so I'm going to briefly go over what each of these two hormones represent in their names. It's super important to go back and review the textbook because there's a lot of detail we've left out. But with this stuff, you have a fair idea of what's going on. So let me clean up all this stuff here and break down their names to help you remember. So we got estrogen. Estros literally means the making of the egg, and genesis, to create. Whereas progesterone means supporting getting pregnant. So, estrogen facilitates the egg creation, and when the egg is ready and ripe, it busts out from the follicle. And progesterone, it makes sure the body is quiet so that the baby can eventually form and stay put. So this indirectly tells you their functions without too much stress of having to think of what's going on. So let's assume that a baby needs to be formed in the uterus. The baby will need to have increased blood supply, yes? So progesterone causes increase in blood supply to the uterine lining in anticipation that the woman will get pregnant. Now, if the woman does not get pregnant, the ovary can produce progesterone just for a particular amount of time, about give or take 2 weeks before it starts to reduce the amount of progesterone it is making. When that happens, when the amount of progesterone starts to decrease, immediately the lining of the uterus starts to come off, because progesterone, it encourages the uterus to stay quiet. It's kind of like a sleeping pill for the uterus. So if, let's say, the level of that sleeping pill starts to go down, the uterus is a very, very angry lady when she wants to be. She doesn't like anything inside her, so she starts to squeeze. And next thing, the lady has her period, because the progesterone levels came down, and the increased blood supply that the progesterone levels cause also has to be ripped off, and so she bleeds.